Hi, my name is Bianca Nunez, and I'm a full-time nursing student at Nevada State College, and I'm here today with Professor Marcellus. Today in the ER in room B, we have patient Alfredo Medrano Gonzalez. Date of birth is 8/21/97. Patient came in today for stomach pain. So a little background about the patient. The patient has no allergies. Patient is currently not taking any medication. Patient does have some history in the family, such as appendicitis running on the father's side. The father had to get his appendix removed. Otherwise, there's no other illnesses in the family, such as no colon cancer, stomach cancer, or liver cancer on neither side. The mother has no history as well as grandparents, no history of that either. The patient doesn't have any illnesses that we need to be aware of. The patient did inform me that he did eat steak and shrimp yesterday, which caused the stomach pain. He hasn't ate anything since. The patient did inform me as his lifestyle goes, as far as his diet, he doesn't necessarily really eat shrimp and steak on a regular. He tries to incorporate as many vegetables as he can, as well as eating chicken. Also, the patient does exercise a lot. He does walk about 6 miles a day. The patient did inform me that he has gained some weight. The patient stated it wasn't something that happened all of a sudden. It has happened occasionally as far as the weight gain. The patient does drink occasionally. I did ask the patient if he smoked. The patient informed me he is not a smoker, but he has in the past. Patient did use recreational drugs such as marijuana. He's never used any tobacco products. As far as that goes, so with assessments, today I did his vital signs and I did as well as an abdominal assessment on him to see where we're at with the patient. For temperature, the patient's temperature was 98.7 degrees Fahrenheit. His blood pressure was 110/76. His pulse ox was 95%. Like I said, his pain was a 4. And his pulse was 72 pulses per minute. His respirations was 18 respirations per minute. I asked the patient if the pain was localized or if it was radiating. Patient informed me it was a localized pain. I did ask him when his last bowel movement was, and he said it was at 11 in the morning. Patient stated it was brown color. It was solid. He stated he didn't have any pain going to the bathroom, and that included as well as going to poop and pee. He said he has no difficulties with that whatsoever. As far as his assessment for his abdominal, when I inspected him, there was no distinction. There was no lesions or hernias. There was a scar that was present. As for auscultations, for the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant, all were normative. As for percussions, for the right lower quadrant, it was tympani. For the right upper quadrant, it was dull. For the left upper quadrant, it was dull as well. And for the right lower quadrant, it was tympani. So it was dull in the areas of where the liver and the spleen were. Also, when I did palpations on the patient, I did light and deep palpitations on him. There was no tenderness, there was no masses, there was no distinction, as well as there was no organomegaly. Patient didn't have any pain when I performed that assessment on him. The patient did say it was most likely from the food that he ate, but he just wanted to get some help to feel better. Overall, I recommend the patient to follow up with us in about 4 months or so to see how everything's going. If anything changes do happen, that he is more than free to come back, for we can assist him. Thank you.